So there are three measurements which we will be studying: vertically the length, and then the transverse diameter, and then the anteroposterior diameter. So if you can see the measurements are like this: 3 centimeters and then 2.5 centimeters and 2 centimeters. So 3 into 2.5 into 2 centimeters. As I already mentioned, the whole of it will be located within the frontal bone. And this will be draining through a tubular channel. If you see, this will be draining through a tubular channel into the middle meatus of nose. I'll just draw a small outline of the lateral wall of the nose. So if this is the outline of the nasal cavity, so here the roof, this is the floor. So then here, after removing the 3 concha, only a part of the turbinates or the concha will be left behind here. So this is superior concha, space below superior meatus, middle concha, space below that middle meatus, and now this is inferior concha, and now this will be your inferior meatus. So superior concha, now between the base of the skull and then the superior concha, this space will be called as sphenoethmoidal recess, and this gets the opening of the sphenoidal air sinus. Now this is superior meatus, so this will be getting the opening of posterior ethmoidal sinus. Then this is middle concha, below that there will be middle meatus. Here just below the middle concha you will see there is a bulge. So this was called as bulla ethmoidals. So this was receiving the opening of your middle ethmoidal air sinus. Below that you could see a semilunar space. So this was called as hiatus semilunaris. Hiatus semilunaris, because it is semilunar in shape, so that's why it is called as hiatus semilunaris. This hiatus semilunaris was receiving the opening of the frontal air sinus through an infundibulum. It's a narrow channel what you are seeing here. So to this, the anterior ethmoidal sinus plus the frontal air sinus, both of them they will be opening here. So I can just show this. So here this is the opening of the frontal air sinus. This also gets the opening of the anterior ethmoidal sinus. So this is your triangular frontal air sinus. Okay, so this is the opening of the frontal air sinus, which you will see in the anterior portion of the hiatus semilunaris in the middle meatus of the nose. So now coming to the nerve supply, blood supply, and then the lymphatic drainage, because it is there in the front of the skull, so that is located within the frontal bone. So closely related with the frontal bone, we had already seen the nerves and the vessels. So this was called as supraorbital nerve and vessels. So this supraorbital nerve and vessels, they come and supply the frontal air sinus. So whenever there is any blockage of this opening of the frontal air sinus in the middle meatus of the nose because of infection of the nose, so that is otherwise called as rhinitis. So if it is left untreated, there can be blockage of this opening. So the secretion from the frontal air sinus will not be draining into the lateral wall, so it gets blocked here. So the blockage, collection in the frontal air sinus, so and then this results in sinusitis. So the inflammation of the frontal air sinus resulting in frontal sinusitis. So patient, if you just see, he presents with a headache. So that is one of the common complications of your sinusitis that we will be discussing later. So nerve supply is by supraorbital nerve and the vessels, and then lymphatic drainage is to the submandibular group of lymph nodes. So coming to the applied anatomy, it is nothing but frontal sinusitis. So that's all about the frontal air sinus. Now coming to the second group, so that is the ethmoidal air sinus. So these ethmoidal sinuses are actually very small in outline. So if you just see the location here, so this is the roof of the nasal cavity. So this is the medial wall of the nasal cavity, and this is the lateral wall of the nasal cavity. The roof of the nasal cavity is formed by the ethmoid bone. So here between the This is orbit, and now here this is the nose. So between the lateral wall of the nasal cavity and then the medial wall of the orbit, here you will see the location of the ethmoidal air sinuses. So these can be classified into three groups. So they are anterior, middle, and then posterior. Usually they are 1 to 18 in number. So when you look at the anterior group, it can be 1 to 18, and coming to middle, these are usually, anterior will be 1 to 13, and middle will be few in number, 1 to 3, and posterior will be 1 to 11. So this can be the number, usually ranging from 1 to 18, whole of it. So these are very small small air sinuses divided into three groups: anterior, middle, and posterior, of which anterior and posterior will be the larger group compared to the middle group. Okay, so now once we have seen the location, so their location, so between the lateral wall of the nose and then the medial wall of the orbit, so divided into three groups. So these, they open into various spaces. So if you come here to the lateral wall diagram, so you can see here the posterior group is opening here into the superior meatus, so below the superior concha. Then coming to the middle ethmoidal sinus, you can see here in the middle meatus of the nose, you are seeing a bulge. So this bulge was called bulla ethmoidals. On the summit of this bulge, you will see the opening of the middle ethmoidal sinus. Now coming to the anterior group will be joined by the frontal air sinus. It will be opening through a duct, ethmoidal infundibulum. So it will be opening here into the anterior portion of the hiatus semilunaris in the middle meatus of the nose. In this diagram you can see here, so this is the opening of the frontal air sinus into the duct system. So this is superior concha, this is superior meatus, this is the opening of the posterior ethmoidal sinus. So now come to this is middle concha, and now this is the middle meatus. So nearer to the middle meatus, you are seeing the hiatus semilunaris. This hiatus semilunaris, you are seeing the opening of the, just above the hiatus semilunaris, you are seeing the opening of the middle ethmoidal air sinus. So here, this is the bulge which will be created. This will be the opening of the middle ethmoidal sinus. The posterior one will be receiving the opening of maxillary air sinus, that we will discuss later. Okay, so this is about the opening of middle ethmoidal sinus, then the posterior ethmoidal sinus, and then anterior ethmoidal sinus will also be joined by the frontal air sinus. So through the infundibulum, ethmoidal infundibulum, it will be opening into the anterior portion of the hiatus semilunaris. So this is about the ethmoidal air sinuses. Now coming to the nerve supply and blood supply of ethmoidal air sinuses, these are supplied by anterior and posterior ethmoidal nerve and vessels, mainly the anterior. So anterior and posterior ethmoidal nerve and vessels, so these are seen in the orbit, so they will be supplying the ethmoidal air sinuses. Coming to the applied anatomy, again any blockage, so that can result in sinusitis. So this is relatively little less frequently seen, ethmoidal sinusitis. So that is about the applied anatomy of the ethmoidal air sinus. And the lymphatic drainage here also, again it comes to the submandibular group of lymph nodes. Now coming to the third air sinus, so that is the sphenoidal air sinus, which I have not shown in any of the diagrams. Sphenoidal air sinus. This, if you remember, when I was talking about the class on the cavernous air sinus, that is one of the dural venous sinuses, I had told you whatever the diagram you write for the cavernous sinus, it will be the common diagram for sphenoidal air sinus also. Cavernous sinus is a venous sinus. For sphenoidal air sinus also, it is the same diagram, and even for the pituitary gland. So if you remember, we had written, so this was the body of the sphenoid within which we had written the sphenoidal air sinuses. So this is your sphenoidal air sinus. Coming to the measurement of the sphenoidal air sinus, I can put it in common terms as 2 into 2 into 2 centimeters, all in terms of 2. So this is the sphenoidal air sinus within the body of the sphenoid, and this sphenoid, it has got a depression which holds the pituitary gland. Now this is the pituitary gland. So this was the endosteal layer of the dura mater, and now this was the the one which was forming the capsule for the pituitary gland, this was the meningeal layer of the dura mater, and in between these two we could see the cavernous sinus, if you can remember this diagram. And here, forming the superior relation for the cavernous sinus, we had seen the internal carotid artery. So this was internal carotid artery. Then we could see here optic nerve, optic chiasma, and then the optic tract. So this was optic nerve. This is crossing optic chiasma, and now this is optic tract. So this is your sphenoidal ear sinus. This is your cavernous sinus. This is your pituitary gland. Okay, so this was the common diagram. So if you just see the location of the sphenoidal ear sinus with measurements 2 into 2 into 2 centimeters, so this is located within the body of the sphenoid. And above that, so superiorly it is related with the pituitary gland. It is also seen in relation with the internal carotid artery, and then the optic nerve, chiasma, and then the optic tract. So laterally the sphenoidal ear sinus is related to the cavernous sinus, and then below it will be related to the roof of the pharynx. So these are the relations of the sphenoidal ear sinus. So this sphenoidal ear sinus, so it comes and opens into this space. So if this is the lateral wall of the nasal cavity, so if you just see here, so the space between the roof of the nasal cavity and then the superior concha, this space, so this was called as sphenoethmoidal recess. This sphenoethmoidal recess gets the opening of sphenoidal ear sinus. So sphenoidal ear sinus comes and opens here into the sphenoethmoidal recess. So that is about the opening of the sphenoidal ear sinus. And now one of the classical features in the infections of the sphenoidal ear sinus is, so here, so sphenoidal ear sinusitis, there will be deep-seated headache. So that deep-seated headache itself gives us a clue that there can be sphenoidal sinusitis. So that is the importance of sphenoidal ear sinus. Now the last one what we will be discussing will be the maxillary ear sinus, which is actually a main question for 10 marks, and it is one of the important and frequently asked questions from the paranasal ear sinus.